When the hospital is hours away and every second counts, master the art of survival. This is Survival Medic.
When we talk about basic patient assessment, one important aspect we need you to focus on is the patient's spinal cord. While spinal cord injuries are rare, it is still very important to protect the patient's spinal cord. The structure of the spine helps offer protection itself. The spine contains a series of bones stacked on top of each other called vertebrae. Within each vertebrae is a canal which houses the spinal cord and the nerves. Injuries to the spinal cord can have major consequences, such as paralysis. This is when the patient loses the ability to move part or all of their body. We should consider a spinal injury under certain circumstances. Such situations can include falls from heights greater than 3 feet, falls down 5 or more stairs, or the patient or victim being involved in a high-energy collision. These circumstances all increase the risk of a spinal injury, as does being over the age of 65. One example would be a patient who was rock climbing and fell 20 feet. In this instance, we would be concerned about many different types of trauma, and we would also be concerned about damage to the spinal cord. There are many ways that we can help support a patient with a suspected spinal injury. The first thing to know is that patients with spinal injuries often self-immobilize. This means that they will not want to move their neck or spine due to pain. In addition to patient self-immobilization, there are things we can do to help support the spine. A backboard is a rigid board used to keep someone's spine immobilized after an accident. While they do provide immobilization, there can be problems with the patient's airway because the patient is strapped to the backboard. It can take time to strap the patient onto the board. Backboards add significant weight to the patient, and they need to be carried out. Backboards can be very uncomfortable for the patient. Backboards can even lead to pressure ulcers. Pressure ulcers are skin injuries due to prolonged pressure. Instead of complete immobilization, we often like to think of spinal cord protection. Spinal cord protection is where we attempt to reduce movement and minimize the chance of further damage, but without complete immobilization with a backboard. We use a series of questions to try and assess the patient's spinal cord in the field. First, and most importantly, we need to know, is the patient alert and oriented? Are they reliable? Do they know who they are and where they are? Are they sober? Do they have any other major trauma that could be distracting them from noticing problems with their neck? We would describe a distracting injury as one that is so severe it takes away the patient's ability to focus on the examiner and answer their questions. For example, let's think back to the rock climber that fell 20 feet. While we are worried about a spinal cord injury, they may have a broken arm or leg. If the patient has a broken femur, this will be incredibly painful. They may not be able to focus on an injury to the spine or be able to tell you if there is pain in their neck. This would be an example of a distracting injury. The second question we ask is, do they have a normal neuro exam? This means the patient can move and feel all their arms and legs. The third question we ask is, does your neck hurt? We can palpate the vertebrae at the back of the neck. If their neck pain is severe, then we would need to immobilize. If their neck pain is mild, then we could consider not immobilizing. Finally, we ask ourselves, can the patient move their head up and down and side to side about 30 degrees? If they can do this without pain or numbness or weakness, we can consider the spine evaluated and safe to move. In this case, we do not need to immobilize the spinal cord. As a reminder, we are currently trying to decide how to move a patient. Let's take a look at an example where we can clear a patient's spine. You come across a scene where a patient was rock climbing. Her friends tell you that she fell about 5 feet. First, you want to ask her who she is and does she know where she is. She is alert and oriented and she knows what's happening. She has now passed the first question. Second, you ask her to move all her arms and legs. She can do this and she can feel them. She has now passed the second question. You palpate the back of her neck. She says it hurts a little bit, but nowhere specifically, and she has no pain when you feel over the vertebrae in her neck. She has now passed the third question. Finally, you ask the patient to move her neck up and down and side to side. She's able to do this without pain, numbness, or weakness. She has now passed the fourth question. At this point, you can consider the spine evaluated and cleared, and you do not need to immobilize it. Next, we will discuss what actions to take if you are unable to clear the patient's spine. Here is what you will do if you cannot clear someone's spine and need to immobilize their spine to protect it. The first method we can consider is manual stabilization. There are several different ways to do this, but the most common method we use is to have one rescuer put their hands on the patient's shoulder. One hand goes on each side of the head, and the rescuer is above the patient's head. The rescuer will squeeze the patient's trapezius muscles with their hands and use their forearms to prevent the patient from turning their head side to side. In addition to manual stabilization with the rescuer, there are other supplies that we can use to stabilize. One common way that people stabilize the neck in the field is called a SAM splint. There are different types of collars that people can make with the SAM splint. The basic method is to have one person stabilize the patient's head while the second person uses the SAM splint to make a cervical collar. This helps protect the patient and prevent them from moving their neck around. You can see this later in our skills videos. In the instance that a SAM splint is not available, other items can be used to help immobilize the spine, such as backpacks or jackets or other bulky items. These items can be placed on either side of the patient's head and neck and secured to help prevent the patient from moving side to side. Now that we are done discussing how to clear a spine, we're going to look at movement of patients who are still in spinal precautions. We try to keep the patient in a spinal neutral position if we are concerned about an injury. The neutral spine position we use is to keep the patient lying flat. When we go to move patients in spinal immobilization, we will support their neck and keep their spine aligned.
Be prepared for the unexpected. Get your copy of Wilderness First Aid on Amazon today. Link in the description.